Do I have your permission to share this video with my online DAT class, Corrective Techniques with Movement Dysfunction?
Yes.
All right, so we're going to start off with the push-up assessment test. I think there are several different testing systems that use this exam, but this was specifically from the Corrective Exercise Specialist through the NASM. So for this test, you're going to have your hands shoulder width apart, legs straight, and then just do 5 push-ups. So, great form here. Relax. Go ahead and hold that push-up position for me. Things that we'd be looking for here would be moving in the low back either down or up. We look for elevated shoulder blades, overactivation of the upper trap. Look for inability to perform exercise. Look for hyperflexion in the cervical spine. Any of those things would be positive exams for weakness or inability to complete this test. So you can relax. So from a corrective exercise standpoint, anytime we're doing any sort of push-up maneuver, most important part is going to be core activity and being able to do abdominal bracing and proper breathing technique. So go ahead on your back for me. So we would start off with some core training, core activation. Knees up for me. And just like before, previous activities, we would have 2 fingers right on above your hip bone, and we would try to activate the core. So you're going to be squeezing down, bringing your navel towards your spine. I tell people contract as if you're laughing or if you're in the bathroom. Nope. All you're doing is squeezing right there in the core. You feel that contraction right there? Okay. Hold that for 10 seconds, 15 seconds. And continue to breathe normally while you're doing this. All right? So this is always step 1 of any sort of core activity. Go through these exercises and relax. Okay? Go ahead and from this position, we can do several different activities in engaging the core, moving the legs. Nope, 1 leg at a time. There. Other leg, opposite leg. Perfect. While continuing to engage the core, go ahead and do 5 reps. That's 2 right there, 3 more. Continue to engage that core the whole time. Continue to breathe the whole time. Good. And 1 more. And relax. All right. So, obviously, we go through our core progression, breathing progression from previous weeks. Then we add in the push progression. So flip over. Now we go hands and feet, or excuse me, hands and knees. So for someone who had inability of completing the push-up assessment, we start off in the quadruped position, and frankly have them stationary in this position and doing an abdominal brace. Nope, just holding this stationary position. All right. From this point, we'll evaluate, make sure there's no scapular winging, making sure he's in good body position here and in the low back. Good. Now from this position, we can incorporate a push-up. Go ahead and do 5 reps. Good. And then from this position, still quadruped, we can incorporate unstable surface. With the upper extremity, same thing. Go 5 push-ups. Continuing to brace, continuing to breathe. Good. And we can also incorporate the unstable position in the lower extremity. Not a lot of change here, but just a different perspective for the body. Go ahead, 5 more push-ups. Relax. Now we can go into the full push-up position. Go ahead and do 5 for me. This guy's nice and strong, so he's got great form, but he's not even tired yet. And from this position, we can do a couple different things just to continue to progress. We can incorporate hand walking maneuver. So full push-up position. We can start off obviously in the quadruped, but for him, since he's having good success with these exercises, go ahead and walk up with your left hand onto the unstable surface and right hand. Yep. Good. And walk back. Good. And then we can go ahead and walk up on the unstable surface again and do a push-up there. So we can incorporate all these things. Walk back. Good. Go ahead and do 2 more for me. Walk up, push up, and walk back. Great form. Continuing to breathe. Continuing to keep that low back in good position.